Good morning, distinguished experts, ladies and gentlemen. On behalf of the International Narcotics Control Board, it is a pleasure to be with you at the International Forum on Drug Policy, and I note with appreciation that this forum is focusing on the threats posed by trafficking and non-medical use of fentanyl and other synthetic opioids. The international community, supported by INCB and other UN bodies, has been taking active steps to contain public health crises related to these substances, preventing the misuse of opioids and precursors for their illicit manufacture has been an international priority for some years, with member states taking action through, among other things, international scheduling of precursors, improved prescription regulations at the national level, law enforcement cooperation, and capacity building. Yet the opioids crisis continues to rapidly expand, with global prevalence of non-medical use of opioids nearly doubling over the past decade, according to the UNODC data. The nature of the crisis varies from region to region, given the global imbalance in availability of and access to legitimate opioid medications. For example, lack of availability of legitimate opioid-based medicines for palliative care and pain management is related to abuse of non-scheduled opioid analgesics such as tramadol and now tapentadol, and not just in developing countries but increasingly in other parts of the world. Non-medical use and trafficking of fentanyl and related substances were previously largely confined to parts of Europe and North America, where the highest global levels of consumption of opioid analgesics are seen. But illicit manufacture has increased availability dramatically in every region. Between 2016 and 2021 in the United States, the price per pure gram of fentanyl on the illicit market almost halved, while at the same time overdoses nearly doubled to 107,000 deaths, largely opioid related. Non-medical opioid use and overdoses are now being reported from New Zealand to Argentina, where serious health consequences and overdose deaths occurred for the first time in Buenos Aires to February. I would like to recognize the efforts made by the government of China for the comprehensive and permanent class controls over fentanyl analogs that were introduced in 2019. These voluntary actions went beyond the minimum international controls of some fentanyls and had an immediate impact on containing trafficking of fentanyls to consumer markets globally. As you may know, the illicit manufacture of fentanyl and other synthetic opioids would not be possible without the input of precursor chemicals. In this regard, China, because of the size of its chemical industry, is a critical stakeholder for international precursor control. Over the years, the board has been cooperating with the government of China, both in the monitoring of international legitimate trade in precursors, as well as operational activities that seek to investigate precursor incidents and prevent the diversion of such chemicals to illicit channels. Pending finalization of a tool to exchange information about planned exports of chemicals not under international control that could be used for illicit drug manufacture, China is already informing importing countries about such shipments on a voluntary basis. Few places remain untouched by the non-medical synthetic opioids crisis, as traffickers have adapted to new technologies, expanding into the surface internet, darknet, and increasingly closed, encrypted chat-based platforms to market their products globally. This was further exacerbated during the COVID-19 pandemic, as many people around the world experienced distress due to related social isolation and economic difficulties, limiting their ability to access drug treatment services and illicit opioid medications. Increased online purchases and express delivery of illicitly manufactured, falsified, and substandard pharmaceutical opioids pose a serious threat to the health and well-being of users unaware of the potential toxicity. This is of increasing concern with the emergence of next-generation non-medical, synthetic, non-fentanyl opioids, in some cases even more potent than fentanyl, and more likely to be associated with the risk increased risk of overdose deaths. To address the new challenges related to the opioid crisis, INCB has supported member states on multiple fronts. Since 2017, INCB's Global Opioids Project has been building and expanding partnerships with enforcement agencies and key industries to stop the trafficking of non-medical synthetic opioids. INCB has been building a capacity and facilitating the exchange of information and innovating targeting of platforms has resulted in dismantling organized crime groups. INCB released its list of dangerous fentanyls with no known legitimate uses, which has been actioned by governments and industry partners to identify and voluntarily refrain from their manufacture, distribution, and sale, and in 2021 expanded its list to include the latest emerging non-medical synthetic non-fentanyl opioids to prevent their spread and use. Similarly, the board has expanded its international special surveillance list of non-scheduled chemicals used in the illicit manufacture of fentanyls. The board has also worked to schedule 5 fentanyl precursors under international control. In this regard, the board notes the concrete steps taken by China to enact relevant controls over 2 of these chemicals following their scheduling in 2017. I am confident that member states will also move fast in implementing the latest decision of the Commission on Narcotic Drugs in March this year to schedule 3 additional fentanyl precursors and place them under national control by November 2022. Now more than ever, international cooperation with governments and through them industry are critical to responding to trafficking, addiction, and overdose from fentanyl and other synthetic opioids. The board looks forward to continued cooperation with all member states in strengthening the implementation of the international drug control treaties for the benefit of all humankind. Thank you for your attention.